Good evening. This topic is Antibiotic Stewardship, Module 5. Antibiotic stewardship, what does this mean? I hate to admit this since I work in infectious disease, but I have never heard of this term. However, a third of our patients are on antibiotics due to diagnosis of osteomyelitis, MRSA, staph, etc. And they're on vancomycin. Luckily, I am surrounded by some of the top experts in this field. Antibiotic stewardship has been started because of the costs to healthcare settings, the cost to our patients, and because of antibiotic resistance. Antibiotics saves lives. There was a time when people would die of the simplest infections, and because we have antibiotics, we are surviving bacterial infections that once would have killed us. Penicillin and Z-Paks are the antibiotics that are most widely used. We in healthcare are more aware of the big guns like vancomycin, clindamycin, levaquin. Antibiotics don't come without side effects, one being C. diff, which affects the GI tract. C. diff infections can become chronic. The second most important side effect is antibiotic resistance. Antibiotics only treat bacterial infections, not viral infections. Antibiotics kill bacteria and/or stops the ability of the bacteria to reproduce. This is when the problem begins, because some bacteria become stronger and unable to resist the antibiotic. In a sense, become immune to the antibiotic. Survival of the fittest. No one knows why this happens, but the most common theory is the misuse of antibiotics. When I'm in triage, I hear this comment every day, all day. I have an infection and I don't want to come in. Can the doctor just call in a Z-Pak? Our response is always, let's make you a sick visit so you can be evaluated by the provider. Although practice has changed, providers were prescribing antibiotics for all ailments. Even though it is common knowledge the common cold is a virus, many patients think antibiotics can treat it. Society needs to be educated and must be enforced. Antibiotics are used for bacterial infections and do not help with viral infections. Other theories are the overuse of antibacterial soaps and the like. We kill the good bacteria along with the bad. We become less capable of fighting off small bacteria, making us susceptible to the super big bacteria and the use of antibiotics in our food, especially meat products. But I won't get into those for this discussion. Remember the 5 rights we use when administering medications to our patients? Right patient, right medication, the right dose, the right route, and the right time. Well, antibiotic stewardship have 4 similar rights. Patients receive the right antibiotic at the right dose, at the right time, and for the right duration. It is very important to note we as nurses must take the time to teach our patients about their prescribed antibiotics and to encourage, if not insist, they finish the antibiotics as prescribed. The administration of the prescribed antibiotics is an inpatient setting, ideally scheduled and controlled, but things change when the antibiotic is self-administered. How many times have we heard a patient state, "Oh, I stopped taking the antibiotic because I was feeling better"? Again, education is the key. Our society has been trained to believe in a quick fix. The CDC has developed 4 core measures to help slow down the progression of treatable bacteria from becoming untreatable super resistant bacteria. Prevention of infection is the number 1. Educating society on ways to prevent infections. For years now, my practice setting has provided a foam in and out policy that we must follow. To help adhere to this policy, there are multiple antibacterial foam dispensers throughout the hallways available for both staff and visitors to use before and after a patient encounter. To help with staff compliance, quality and assurance nurses conduct observational quarterly audits demonstrating who is in compliance. Education is then provided to those not to be in compliance to this policy. Preventing infections reduces the need for antibiotics, thus providers do not have to prescribe medications as much, slowing down the pace of resistance. Number 2, Track antibiotic-resistant infection. This shows who's getting the infections, why they're getting the infections, and where is the prevalence of this infection. 3. Developing new antibiotics and diagnostic tests tracking the resistance. 4. Antibiotic stewardship. Putting policies and protocols in place to ensure proper prescribing of antibiotics and its uses. Quoting the CDC, effective stewardship ensures that every patient gets the maximum benefit from the antibiotics, avoids unnecessary harm from allergic reactions and side effects, and helps preserve the life-saving potential of these drugs for the future. Efforts to improve the responsible use of antibiotics have not only demonstrated these benefits, but have also been shown to improve outcomes and save healthcare facilities money in pharmacy costs. In my practice setting, our patients are hospital follow-up, and we have a dedicated nurse whose only responsibility is to monitor these patients on antibiotics, both IV and orally. This is called OPAT, Outpatient Antibiotic Treatment. She works closely with the providers and the at-home nurses, checking weekly CRPs and CBC and DIF results. And if a patient is on, for example, vancomycin, making sure therapeutic levels are checked and are within normal limits. Any deviation, she reports directly to the provider. On a smaller scale, as I've already stated, we encourage patients who ask for antibiotics to make sick visits for evaluation. It is our policy to educate our patients on the proper use of antibiotics and explain why providers insist on an evaluation. To answer the Ebola connection, Ebola is a virus infection, not a bacterial infection, so antibiotics do not treat Ebola. Antibiotics may be prescribed for opportunistic bacterial infections that may attack an already compromised immune system. Research is being done to find the right antiviral medication to treat Ebola. Antibiotic resistance occurs because the bacteria mutates and becomes stronger. Well, this is the same for viruses. In my clinic, we have a strict attendance policy. This is done not to punish patients or to make their lives miserable because they have to come every 3 to 4 months, but because the HIV virus likes to mutate and become resistant to antivirals. If the patient does not take the medications consistently, it opens the door to creating a new strain of HIV that does not respond to previous prescribed antivirals. Stewardship is to remind us that it is our duty to educate the public. Thank you.